happening?
Good deal.
Hey, what's going on? All right.
But, yeah, none of those groups that were there before. And, yeah, you can see all the tires where they were, I guess they were really happy about it. A lot of bikers, a lot of walkers. And I don't know if it's been sealed off, but I think it's been sealed off. So,
Yeah, I think that's something.
I know that the reservoir has been
Right.
sealed off, but I'm not sure, because the way the reservoir overlook is, it's really the parking for the walking.
Right, for the walking trail.
So,
I guess there'd probably be some entrances from some neighboring or something like that. For some of the trail.
well, the only way you can really hook on is to park all the way down Richland proper itself,
Right.
and then get on through the backside and then go all the way. Well, it's fine to bike, but if you're walking, it's a long ass walk.
Right.
Unless you're a marathoner, 5K, it's a long way to go too. You don't know the password here, do you?
Just wherever you want. If you want to go, come on. Well, that might make Jimmy correct. Thank you. Thank you all for being here today on Monday. We are 3 days into our shelter-in-place order. I have been receiving updates from our state and from our local leaders all across our Mississippi, and I am encouraged by what I have heard. Mississippians are stepping up. There will always be some who disregard the law, but by and large, Mississippians understand the need to protect their family and their neighbors. They're working hard in uncertain times. It's not easy to be isolated. We were created for community, and particularly in Mississippi, we love hanging out with our friends and our families. We know that you are doing something hard, but we also know that you are doing it well. I want to thank each and every one of you for stepping up to do your part to help us get through the coming days and weeks. This is not easy, but we will get through it together. Our focus today is going to be on the public health crisis that is unfolding across our country. But I do want to take a moment and talk about another crisis that is running alongside it. The United States is facing historic unemployment brought on by this deadly disease, and we are feeling that here in our great state. We've already seen a 3,000% increase in unemployment claims in Mississippi. That's never happened before. That is going to get worse before it gets better, just like this virus and the deaths associated with it are going to get worse before it gets better. No system was created to handle that kind of drastic increase overnight. The employees on the line at the call center are working class folks. They're trying, but they're being asked to do 3,000% more work in a very short period of time. We've increased the hours. We've increased the staff. We've increased the ways you can apply. We're still trying to catch up to the massive numbers. That doesn't help if you're trying to get through and can't. I know that, but we are working to make it right. You will get what you are entitled to, no matter when you get through. Your money is based on when you lost your job, not when someone answers the phone. There are some new solutions in the works to deal with this historic increase. It's going to get fixed, and we're going to provide more help than ever before. Mississippians are generous people. Please look out for your neighbors. They may not broadcast it, but many need food or a little cash just to get by until we can get this right. I also want all Mississippians to know that you will not personally be on the hook for payment for COVID-19 treatment in a Mississippi hospital. Major insurers are waiving those requirements. And if you are uninsured, in my conversation with the Vice President and his team today, he assured me that the federal government will cover those that are uninsured. Seek treatment if you need it. You will not be required to pay on this COVID-19. I want to give an update on what the state is doing to prepare as we enter what we believe to be some very dangerous, deadly weeks ahead. The health experts on the President's COVID-19 task force have advised us that the data from the Institute for Health Metrics and Evaluation is what they are most closely tracking. We have been doing that as well for a long time. That information is public and available at healthdata.org. But let me be clear, there is no perfect model. It's like a weather forecast. It's not going to be exactly right. It's designed to be as accurate as possible, giving the data that is available at any point in time. In fact, just in the last 12 to 36 hours, it was revised down drastically. Our plans are based on recent higher projections, but this is the one that the nation's top experts are following. They predict that we are approximately 12 days away from peak resource use, and that would be approximately April the 18th. Just yesterday, their model suggested April the 21st. So as you can tell, lots of changes are happening readily. It could still be sooner or later, but we believe it will be near the last 2 weeks of April. That is why we have held the shelter-in-place order for this most critical period. As Dr. Dobbs has said repeatedly, as Dr. Byers has said, as many of our experts have said, the shelter-in-place order is not a long-term solution. It is a temporary tool. Remember that all of this is aimed at preventing our healthcare system from becoming overloaded at the top of the curve. We are getting closer and closer to that moment by the day. In our state, we have faced more emergencies than most. We know that we must plan for the worst, pray for the best, and expect somewhere in between. We also know that we cannot simply plan for what is projected. We've taken the recent IMHE projections for how many beds we need, and we've increased them by 50%. That is our minimum target for preparedness. You can see that based on those surge plans, we could need at least 3,392 total beds for patients at our peak. We currently have 3,000 available. We may need to increase capacity by at least 400 in coming days, and I plan to tell you what our plans are to ensure that we have those 400 beds, approximately 400 beds available. 250 of those beds are currently ICU beds. We plan to increase our ICU beds by at least 254. We have, we believe, an ICU bed reserve of 356 beds throughout the system, and that is what we are planning for. Now, there are three primary methods of scaling up our healthcare system to prepare for the peak. The first is hospital decompression. For instance, we've ordered all elective procedures to stop. We've instructed everyone to stay away from the hospital unless it is critically necessary. The effects of that are already being felt throughout the system. There are places where healthcare workers are stretched thin and working tirelessly, but there are others where medical professionals are waiting in the wings for this surge. The time is coming. This is why we have been trying to reduce any unnecessary hospital use. We have an ICU reserve of 356 beds in Mississippi. Those are not included in the currently available number. They rely on hospital decompression, and they rely on the work of individual hospitals to surge forward. We are working with them to activate them now. As you saw the other day, we are also working with the Mississippi State Medical Association and other leading healthcare experts to develop a statewide COVID-19 system of care. Dr. Hayes and Dr. Claude Brunson were here on Friday, and they discussed those efforts at length. Here's what it boils down to. We need an acute care for patients who are experiencing severe symptoms. We need to treat them, then we need to transfer them perhaps to a different facility so that the next patient can get the same level of quality care. We need transportation to make that process run smoothly. We will need staff because a bed on its own without the proper staff is useless. And we will need coordination within the system to ensure that everyone is operating from the same playbook. All of that coordination has been happening over the course of the last several weeks, and I hope to have Dr. Hayes and Dr. Brunson here again soon to brief you on the progress. It tracks what those who spend a lot of time managing emergencies call the hub and spoke model. The acute care for people who with severe symptoms comes from our larger hospitals, those with large staffs, sophisticated technology, and ICU capacity. We are working with our smaller rural hospitals to develop contracts where they would be paid by the state to house COVID-19 patients who do not require that same level of treatment. They will serve patients who are through the period of needing acute care or have not yet reached that point. I can tell you that they are eager to get involved. We're also working to stand up alternate care sites. We cannot rely solely on our existing healthcare infrastructure. We are going above and beyond. These will serve a similar need as our smaller hospitals. We are working to identify a site in North Mississippi that could handle approximately 200 additional beds. We are closing in on that right now. We have identified a space in South Mississippi, Camp Shelby, which is a National Guard facility outside of Hattiesburg. As I traveled there the other day, along with Dr. Dobbs and others, our men and women in uniform made it very clear. They are ready, willing, and able to step in, as they always do in times of crisis. They would be prepared to handle 200 beds for patients that fit the criteria for this level of care. I saw for myself that this is a real practical solution for this unprecedented problem. So to recap, we are close to our peak resource use. The best available model says that it is coming in the next few weeks. There will be more Mississippians who die from this virus. It is serious, it is contagious, and it can be fatal. We cannot completely stop it from spreading, and we know, as we've said repeatedly, many in our state have unique risk. You can keep yourself as safe as possible by following CDC guidelines. We can all put our trust in the global scientific community to develop a treatment, and we can do everything in our power to achieve one goal. Mississippians who could survive with the best available care should get that care, even as we hit the top of that curve. That is where other countries and perhaps some other states have experienced the most pain and the most loss. We believe we may need 392 more total beds. We believe we may need 254 more ICU beds. We have identified 200 in South Mississippi, and we are close to securing another 200 in North Mississippi. In addition to that, we are working to activate the reserves of approximately 356 ICU beds throughout the system. What does that mean? It means we can do this. It relies on a heroic effort by our healthcare community. It relies on all of our emergency personnel to step up and do what they are trained to do. We still have to execute when the time comes. It relies heavily on the people of this great state working to flatten the curve in the coming days so that our peak is not as devastatingly high as other areas. It relies on you. It relies on you to stay home and stay socially distant. I know that our healthcare workers and our emergency managers are up to the task, and I know that the people of Mississippi are committed to protecting each other. We can do this. We can get through this together. We will get through this and reopen our state and reopen our economy. With that, I have here with me today Director Michelle, General Boyles, and Jim Craig, the Senior Deputy for the Department of Health, to give a quick update, and then we'll turn to questions. I'll start to my far left. General Boyles, would you just make a few comments, please, sir?
I'll just say that Camp Shelby is available because we have dialed down the collective and individual training that's occurring at Camp Shelby, and it'll be dialed down until the end of this event. So that creates some bed space for the governor to use, and we're glad to provide it for the governor. We're also glad to provide the personnel necessary to make the facility available to the state of Mississippi. Thank you, Governor.
Thank you, General Boyles, and thanks to your men and women that wear the uniform every day for stepping up in this time of crisis. Director Michelle?
Yes, sir. Thank you, Governor. I just make a real quick comment on our PPE, which is continue to get a lot of questions about that. The PPE continues to come in. We made some very robust shipments out to our Tier 1 facilities this weekend, both on Saturday and on Sunday, and we had some more stuff come in over the weekend, coming in today, and we're breaking that down. More shipments will go to the Tier 1 facilities today and then throughout this week. And then we also are getting another shipment that we were not expecting from the federal government that's rather large, that consists of gowns, masks, and primary PPE that we need. So we're getting the things in and getting it out as quickly as we can.
Thank you, Director Michelle. Obviously, not only is personnel something that we are looking at, but also ensuring that our healthcare workers, our EMTs, all of our first responders have adequate PPEs. We were on a call earlier today with Vice President Pence, with the leaders of FEMA and others, and I can assure you that we have let them know that we all need more PPEs. That's true in virtually every state. They are working to secure that, and we are grateful that we are going to be getting some additional resources in during this week. At this time, I'm going to ask Jim Craig, the Senior Deputy for the Department of Health and one of our foremost experts, and he did a fantastic job helping teams from the Mississippi National Guard, from the U.S. Army Corps of Engineers, from the Mississippi Emergency Management Agency in developing our surge plan. Again, as a reminder, our goal is to plan for the worst, pray for the best, and expect somewhere in between. And so, Jim, would you say a few words, please?
Thank you, Governor, and thank you for your leadership. It's been a pleasure to work on this assignment. Know that we're very pleased at the Health Department to be partnering with MEMA and the Mississippi National Guard and Camp Shelby on this important effort. As you saw today, we have 100 new cases. We have 8 new deaths. Making sure that we have the capacity in the state of Mississippi is important, and this is just another key part of that. Camp Shelby can assist us in caring for patients that are recovering from COVID-19, especially those that are just not ready to return home, or they may not have a home to return to, so they can finish recovering in a convalescent facility. We appreciate the opportunity to be part of this mission. Thank you.
Well, thank you, Jim. I appreciate you. I do want to point out to those that are watching us on TV or on Facebook Live, One of the opportunities that I had yesterday was to wish a few people happy birthday. It may have been the highlight of my last few weeks to see the smiles on the faces of the young folks. I know that there was birthday cakes delivered various places for folks who needed it, and it just warms my heart what Mississippians have done, and I promise you, stick with us. We're going to answer a few questions, and I'm going to wish a few more people happy birthday, okay? We'll start with Scott.
When is there a timeline when those 200 beds in Shelby could be used? Is there a place that's been chosen for acute care in the state?
So our timeline is to have the 200 beds available in South Mississippi and in North Mississippi before they are needed. That's our time frame. In terms of acute care, I'm going to let Jim talk a little bit about that.
Well, and a lot of the acute care will be developed as the system of care that the governor referenced with Dr. Hayes and Dr. Brunson. They're working on that acute care model. But you know, acute care already exists in the state, where our resources for ventilators, for ICUs, and for those practitioners that take care of that acute care phase, that already exists in the
Is
state.
it possible to say that how far away we are from that level where we'll need to use Shelby?
Well, the way I would answer that question is, I hope we never get to the point where we have to use Camp Shelby. This is a plan that we are putting in place so that we have the resources available should we need them. The model that we used to develop this plan, which was dating back till April the 1st, suggested that at that time they believed our peak resource use would be on April the 21st. They've made changes to that model over the weekend based upon some quantitative analysis and, in my personal opinion, some qualitative analysis, which may or may not be accurate. And now they're saying April 18th is our peak resource. All of these models, keep in mind, our plan is taking the model as it existed and applying 150% of expected need at that time. And so we're not looking at any data and saying, well, this is darn sure completely accurate. We're taking the models and the data that Dr. Burks and those in Washington suggested could be the most accurate, and we're taking those numbers and we're planning for 150% of those expectations. But to answer your question in terms of if peak resource use is April 18 or April 21, then you would assume if we were at 150% of what the model suggests, we would start needing this April 15th, April 16th, April 17th, just dependent upon when that occurred. Again, I'm not telling you today that we're going to need these 200 beds in North Mississippi or these 200 beds in South Mississippi. I'm telling you that our approach is we would rather have it and not need it than to need it and not have it. That's what we learned during Hurricane Katrina. That's what we've learned in other disasters around the globe, and that's what Mississippi is going to prepare for. Courtney Ann.
Can you talk about how those sites would be staffed? Would Camp Shelby be staffed by National Guard medics? The site in North Mississippi, if not within a rural hospital, would it be staffed by physicians who are not doing elective surgeries? I'm trying to envision what the staffing would look like for 200 beds.
So I'm going to let Jim address that, but it's going to vary depending on which facility. For instance, we have entered the order to secure Shelby. In North Mississippi, it's probably not going to be a military installation. It could be a number of different things. We've seen a number of suggestions, everything from you don't have these in North Mississippi, but casinos to hotels to dorm rooms at either a community college or a dorm room at our institutions of higher learning. We have teams out making the engineering assessments on that as we speak. And so depending upon what is ultimately decided will depend on how we're going to resource that. Keep in mind, our initial hope is that as the hospitals that have the sickest patients, a sick patient that is needing the most acute care, if they're going to survive, eventually they need less of that acute care, but they're not yet ready to go home. So we hope to use the existing hospital system so as to take those patients and return them perhaps closer to where they live, but also return them to a more rural hospital system that is certainly capable of taking care of them at the level at which we would return them. And keep in mind, in many of these hospitals around the state, they're not nearly as busy as they were 3 months ago, because we're not doing elective surgeries. We're not doing things such as that. So that frees up capacity within the healthcare workers in the healthcare system to provide that care. And so that's going to be our first step-off point. When we move to the other facilities, that's one of the reasons that Dr. Hayes and his team are together is as I mentioned the other day, it's great for us to look and say, okay, we need 392 beds, right? And we can identify 392 beds. We can go do that. But it's not any good if I need 600 beds in Hancock County and I have 600 beds in Tishomingo County. Well, I can say as a state, well, I've got plenty of beds. Well, that doesn't do those patients any good. And so that's why this is an ever-evolving process to make sure we have the right number of beds available in the right number of communities.
And just to follow up, some of the ones that you listed are part of the package that they're putting together. There's teams looking at the resources to supply both the Shelby mission and whatever the other future mission will be. But the parts of the healthcare system right now that are idling are definitely one of the pools that we need to be looking at. Not going to say that it also includes National Guardsmen, may include others that are part of the healthcare system, especially in the respiratory area. We have a lot of respiratory care practitioners that have answered the call. We've asked for additional assistance, and they're ready to help us.
And we're looking at nursing students, for instance, that are near graduation. We're looking at every resource available. For all of us, it's easy to think, well, how do we go find enough nurses and enough doctors? And that's critically important. But when you're talking about opening 200 new beds, you also have to think about things like laundry services and who is going to provide the food. And that's one of the reasons that when we look at Camp Shelby, for instance, they've got those in-house. And so whatever and where there is a gap and it's not a healthcare worker, that's when we'll task Mississippi Emergency Management Agency to resource that, working with our National Guard. It very well may be that we have to continue to resource more guardsmen on active duty. We did get yesterday the major disaster declaration by President Trump. That's a very big and important step. We're working to get our 502F funding from the federal government as well. They've been very clear over the last couple of weeks. There are 2 criteria to receive that federal funding. Number 1, you've got to have a major disaster declaration, which we received over the weekend. And number 2, you have to have activated either 500 or 2% of your total guard. For Mississippi, whichever number is lesser. For Mississippi, that's approximately 250. And as I appreciate it, we have met that threshold now. We have activated 250 guardsmen to help us respond to this crisis. Yes, sir.
Governor, you have roughly 550 respirators that are being adapted at Mississippi State and at Taylor Machinery. How are y'all going to, where will you have it in reserve? The president has gotten a lot of criticism over what he has deemed to be the national stockpile, how it goes out. How are we in Mississippi going to distribute and use those?
Well, our intention is to distribute and use each of these machines based upon where they are needed. There is no doubt that, as was said many times last week, we are more likely to be resource challenged through number of people to work those machines than we are not having enough machines. Now, when we look at the potential shortage, and again, these numbers change and move every day, we believe that we are going to find ourselves in a position where, well, let me just say this, the 500 that are currently being repurposed, at Mississippi State, and I'm going to ask Director Michelle to answer this. I think we received a big portion of those over the weekend. Is that correct?
We did, and I'm, not to get into Jim's business, but we're already pushing those out. And Jim and the Mississippi Department of Health have resourced a number of hospitals over the last few days with those. So they're going out now.
I think we received 50 to 60 to 70% of those over the weekend. We should get the full 500 complement sometime middle of this week, I would presume, as they're coming out every day. We're forever grateful to our friends at Mississippi State, to Taylor Machinery. I mean, look, this is a prime example of Mississippians stepping up in a time of need and providing what we need. If every state had folks like that in every area, there wouldn't need to be nearly the effort at the national level, and you wouldn't see nearly the complaints by some of my fellow governors asking and begging for help from the federal government. Yes, sir?
After a COVID-19 death occurs, how long does it usually take for that to show up in the statistics?
Much will depend on the reporting. You know, the coroners have to actually make the report, or the hospital has to make the report, depending on where the point of death is. And then that reporting will reflect back through our vital records to our numbers that we post. So usually 24, 48 hours is what they've been saying, but I have seen examples where it didn't happen quite that fast.
Just to go back to your previous response, I want to make sure we get this clear. You said some of your other governors are begging and complaining about not having enough ventilators. But not every state had a Hurricane Katrina where you had those 500 battery-powered ventilators. Are you sure you're going to criticize other governors for begging for ventilators when they didn't have a stockpile of 500 ventilators?
I'm not criticizing anybody. What I am saying is that in Mississippi, we understand that disasters such as this are state-managed, locally executed, and federally supported. We have worked very hard to ensure that we have not only the necessary beds available, but the necessary equipment available and the necessary personnel available to deal with this in a worst-case scenario. We still have more work to do. We are going to receive some share of what has been a national stockpile that has been growing and shrinking every single day. As they get more in, they ship it out. As they ship it out based upon where they see the need. Obviously, with New York and New Jersey, for instance, having approximately half of the cases in the United States, that's the biggest hotspot as it currently exists. And so I'm not criticizing anybody. I'm simply saying to the people of Mississippi, thank you for being innovative. Thank you for stepping up and doing everything you can to make sure that we're properly prepared for this particular crisis.
Also, is there testing going on in Jefferson Davis County?
I don't know about specifics.
I would have to pull, it's on our website where you can look and see where the community testing is going on. It is not one of our testing locations today. Today we're in Tippah County providing community testing.
Yeah, I will tell you a little bit about overall testing. It was told to us on the call earlier today that in the U.S. we have now completed 1.56 million tests across the United States of America. Therefore, the total testing rate in the U.S., and by the way, that's heavily skewed to those hotspots in New York and New Jersey. Right now, we're at about 5,200 per 1 million residents. In Mississippi, we have done, we believe, a little over, or approximately 21,000 total tests, which puts us a little over 7,000 per million residents. So our testing rate, even when you include New York and New Jersey, is almost 1.5 times the national average. And one of the things that we have said repeatedly in the early phases of this virus, testing drives total number of cases more than anything else. If you don't test, guess what? You get no positive cases. If you're very aggressive, as Dr. Dobbs and the Department of Health have been on testing, you do two things. Number one, you get more positives per capita, but also you get to start the most important phase of this is once you get a positive is the case management, so that you can keep those who currently have the virus either in the hospital if they need to be, or quarantine or in isolation, but also take that next step and actually contact those that they have been in close contact with and initially encourage and now mandate self-isolation and quarantine for them. Testing is critical. Testing is critical to manage this disaster, and that's one thing that we in Mississippi are very fortunate of, is we became very aggressive very early on testing, and that's one reason I believe that you're seeing the models come down considerably because of the steps that we have taken to control this. Yes, sir.
We've been asking MDOC whether any employees who work in prisons have tested positive for COVID-19. They have refused to tell us. You promised some more transparency at MDOC when you took office. Are you aware of any MDOC employees testing positive, and why isn't the Department of Corrections telling us this information?
What I will tell you is I have been told that we have had approximately 7 employees tested at the Department of Corrections. Of those, 2 have tested positive. To my knowledge, none of them were working at specific facilities, though we will look into that and confirm. I am told, since we had the conversation last week, that we have had 3 inmates tested in 3 different facilities at the Department of Corrections. 2 of those 3 inmates' tests have come back negative, and 1 has not yet returned. So there, to our knowledge, there is no positive test from an inmate at a facility in the Department of Corrections system.
The President's declaration came out yesterday for the state of Mississippi. What does that mean for brass tacks in dealing with the COVID-19 response for Mississippi?
Well, number one, it recognizes that this is a major disaster. It certainly puts us in line with some of the other states. It also gives us the potential, because of the criteria they set up, to get that 502F funding for the National Guard. And so I think I appreciate the President doing that. I will tell you that I believe, and I'm going to let Director Michelle speak to this, I believe before this is over, all 50 states will get a major disaster declaration. I don't get to sign them, the President does. But based upon where we are in the country, I think it's likely that all 50 states will get it, but we're not there yet. Director Michelle, you want to speak to that?
Yes, sir. And so what was immediately granted on that was your Category B, which is your emergency response cost in that, and then the individual assistance piece of that is still under review. We should get some feedback on that, and the reason that has not been immediately answered is they're looking at the supplemental funding to ensure there's no duplicate benefits there, and they're looking at that, and once that is confirmed, we'll get that back, as well as the hazard mitigation portion.
So that's a way to ensure federal reimbursement of expenses on all these things that we're doing.
Yeah, and that's the thing I was trying to reach at, and maybe crystal ball in this thing. But for people at home sitting in the house going, does that mean I'll have a chance at a grant? Will I have a chance at just more low-interest loans?
It does. It could mean all of those things. We don't know specifically what some of those things are going to be on the IA. The governor was very quick to get the Small Business Administration Declaration grant, and there are three pieces to that will assist not only businesses but individuals as well. And then we'll know more about the IA once that's approved.
So there's a large number of things that are going on here and a lot of moving parts. With the major disaster declaration under the Stafford Act at the federal government, individual assistance or something, that's something that happens in every natural disaster if you get the major disaster declaration. That is in addition to over here on this side, which is the $2.2 trillion CARES Act that passed the Congress. And so under the Stafford Act, we immediately asked for Small Business Administration loans. They ultimately awarded us that so that our small businesses could get those loans. Under the CARES Act, you can actually get a loan to pay certain things, and sometimes they can be forgivable. And so you've got not only loans, but loans that are forgivable, which really ends up being a grant. So yes, and we need to get that individual assistance piece as well. If you're an individual out there and you've lost your job, obviously you're entitled to unemployment insurance that the state has in our system, and we've already started sending out pretty significant numbers of those. But those are $235 maximum per week is state benefits. The CARES Act can provide for up to $600 per additional week. If you are entitled to it, you're going to get it. It's going to take the federal government a few weeks to actually get us the money, and it's going to take us about that amount of time to actually recalibrate our system to get you what you need. Yes, sir.
Governor, switching lanes a little bit. With Easter Sunday coming upon us, a church in Adams County had services, Palm Sunday services, with 250 people in attendance. And the pastor says he thinks that his gathering of people in the church does not violate your stay-at-home order. He also pointed out that you said last week that you do not believe that government has the power to shut down churches, even during a pandemic. What's your response to that, sir?
Well, I don't believe that government has the ability to shut down churches, but I do know that the vast majority of churches did the right thing this weekend and did not have services with more than 10 people in a confined space. And I mean the vast majority of services. You know, on Sunday mornings, on a regular Sunday morning, a large percentage of Mississippians go to Sunday school. And at 9:30 yesterday, I actually did a Palm Sunday reading of several scriptures. I prayed for our leaders, and I'm proud of that fact. But people do not need to be going to large gatherings of churches of more than 10 people. It is not smart to do that, and I do believe that it is in violation of the order of keeping folks from being in groups of larger than 10 people. So again, please do not put your people at risk. What we have found is in numerous categories of these outbreaks that we've seen, and generally they've been relatively small, thank God, but funerals and weddings have been a major culprit of community spread in various communities. We can avoid that. We can avoid that by not having funerals of more than 10 people. We can avoid that by not having weddings of more than 10 people for the next 2 weeks. Generations that came before us were asked to go to world wars on our behalf. We're simply asking you to stay at home for the next 2 weeks. Please, Mississippians, be smart, be safe. Cordian.
I believe it was last week that the question may have come up a little bit more about any kind of travel restrictions or checkpoints. Just wanted to circle back with you to see if you believe that everything will stay as it is, or as this progresses, if we see more cases in Louisiana, if there would be any consideration to some type of checkpoint or travel restriction, especially along that southern part of the state.
Right. Well, what I would say is nobody needs to travel from one state to the other. Nobody needs to travel from one county to the other unless you're going to get groceries. And you should only do that if you absolutely have to. I will tell you, and you have heard me say this repeatedly from this particular room, I have been very concerned with what's going on in Louisiana. Over the last couple of days, we've started to see our first bit of good news out of Louisiana. It appears that their curve is flattening. They're continuing to see more new cases. They had a really low number yesterday, but I think that was because it was Sunday. They're going to have I heard Governor Edwards talk earlier today, they're going to have a pop on Monday, on today. It's going to pop back up, not to its all-time high of 2,400 new cases as there was late last week, but it is going to pop to a level that's much higher than it was yesterday. Their total number of deaths day over day is going to come down, it appears. That's positive. That gives me cause for optimism of what's going on in Louisiana. I know they've all worked incredibly hard, but one day does not a trend make, and so let's watch that over the next 2 or 3 days and hope that continues. But to all Mississippians, whether you're in South Mississippi or North Mississippi, there is no reason to cross across the state line unless for the next 2 weeks, period. Don't do it. Don't put yourself at risk. Don't put your family members at risk. If we will all adhere to these guidelines for the next 2 weeks, it's going to make a huge dent in the final outcome here, and I think that's important.
Get some clarification on, I guess one of the most common questions I've got for the past week. People going fishing, specifically fishing at the reservoir. Do you want the reservoir entire body closed down, people not fishing on the res and things like that?
Well, we're working on that issue with the appropriate state agencies. What I would tell you is there is very little risk in contracting the virus if you get in a boat by yourself and go fishing. It's just a very low risk that you're going to contract the virus from yourself. And in fact, if you get in a boat with one other person and y'all are 8 feet apart on either side of the boat fishing, there's fairly little risk that you're going to contract the virus. Having said that, if you get in a boat, maybe a ski boat or a pontoon boat with 10 other people, and then you go upriver and you sit on the sandbar with 20 other boats that have 10 other people, well, you just went to 200 people, and that's what I flew over and saw last Saturday, and that's unacceptable. But we want to work with the folks at the reservoir, recognizing that we want to make sure that we don't thin out our law enforcement personnel, but we want people to be able to go fishing. We want them to be able to get out and exercise individually. Individual activity is encouraged. Hanging out with your family is encouraged, but we don't want large groups out gallivanting. Stick with us and just do what we ask for 2 more weeks, and that'll go a long way towards, we believe, again, it's an ever-evolving situation, but we believe that'll go a long way towards getting us where we need to go. Yes, sir.
Yeah, so across the United States, in places like Illinois, North Carolina, and Michigan, the early data is showing that a disproportionately high number of African Americans are being infected with the coronavirus. Is that true in Mississippi, and have you guys given any more consideration to releasing demographic data?
We can certainly look to see where we are on that. I will say the early indications are we're seeing similar here in Mississippi, that it is impacting the African American community at a little higher rate.
Can you explain maybe why that, or do you have any understanding of why that is? Or?
I don't. That might be a better question for the doctors when they come back to do the interviews.
One last question regarding your stay-at-home order. Would you be upset, or would you countermand a local constabulary that enforces it by arresting people that come across the border or even within, that are out, in groups of 10, 20, 30 people, church gathering or anything, especially coming on this Easter holiday? And if they ask them to disperse, to break up, to go, separate ways, and they don't.
Well, look, I have 100% confidence in our local law enforcement officers to exercise the correct amount of discretion. The way we described it last week and the way I'll describe it today. If you're out on the interstate and the speed limit's 65 and you're driving 66, it's highly unlikely that a Mississippi Highway Patrolman is going to pull you over. However, if you're on a 2-lane road and the speed limit's 35 and you're driving 88 and you blow through a stop sign, you're going to get pulled over and you're probably going to jail. And so what I'm asking is for Mississippians just to be smart, to take necessary precautions, to not do things that they ought not do. And so, what I would say to our local law enforcement, if they see a group of 8 or 9 or 10 or 11 or 12 gathered, I would stop, ask them to go home, to get in smaller groups, to not gather such as that. And if they ignore you, then you should arrest them. That's the proper protocol. But again, we talked with local law enforcement all weekend long, and what we continue to hear is that by and large, the vast majority of Mississippians are adhering to those guidelines. Okay, what I'm going to do now is I'm going to wish a few Mississippians happy birthday. I know some of y'all may want to disperse, and if you do, I'm certainly okay with that, but what you probably ought to do is turn around to the camera and wish these young kids happy birthday, because they're probably not going to get to have a big birthday party this year, but I'm going to wish them happy birthday because I got to see people sent me pictures of their kids and with big smiles on their face, and I know in times like these, it's worth my time to spend just a few minutes trying to make young Mississippians happy. So to Sophie Jeter Turning, she turns 8 today. To Layla Bramlett, to Taylor Jones, to Miss Sheila Renfro's grandson, Cedric Masonette, to Shantasia McGee, to Gavin Brady, to Johnny Gressett and Rachel Bateman, happy birthday. To Bubby Sills. Bubby's parents tell me that God healed his body last week as well from a bacterial infection in his bloodstream. His white blood cell count went from 24,000 down to 14,000 overnight. Happy birthday, and to God be the glory. To Finn Roberts, to Denisha Ivy, to Barbara Kreider, to Austin Rodriguez, Serena Isaac, to Charlie Gaines, to Addison Renfro, to Sophie Goodson, to Lindsay Franks. Happy birthday to Chloe Terry from Columbus, Mississippi, to Essie Dorsey and Michael Robbins, to Parker Evans and Will Rhines, to Emerson Rigney. Happy birthday. Tristan is turning 6 today. Darlene's dad, Burnett, is an 86-year-old veteran as of today. Happy birthday, Mr. Burnett. Dawson Garrett and Bernicia Ballard, to Caitlin Wilson and Colton Amin. Benjamin Johnson is turning 3 today. Happy birthday, Benjamin. Trayton Mitchell and Liddy Kate and TJ Ingram. Happy birthday to you. Kingston is turning 2 today. Happy birthday, Kingston. You're going to be able to get back out and play with your buddies here really soon, I hope. Sam and Elliot Gibbs turn 8. Tristan Jenkins from Pearl, Mississippi, has a birthday today. Marley Hunter and Grant Breland. Sarah Davis up in Greenville, happy birthday. Brianna is turning 15 today. I have a 15-year-old, so I know how special that is. Audrey Ugas in Biloxi. Parker Haynes, Ava Stovall. Janelsa and Sheila in Jackson are both having birthdays today. Happy birthday. Asher Hilton in Brookhaven, Mississippi, down in Lincoln County. I'm told that Jordan Culpepper has a birthday today, and Jordan tells me that she loves Jesus and attends Evangel Temple Church. She also loves softball. Haven Woodruff in Burnsville, Evan Colt Smith, Makina Rain Harris from Amory, Mississippi. Happy birthday. Skyland Mays turns 3 today. Maggie Mae Nichols and Drew Covington. Will Tate in Vaden, Mississippi. McCoy Nichols, he says he plays the guitar and he plays Farming Simulator is one of his favorite games. Journey Homan and Courtney Grace Scott up in Greenville. Grace Scruggs turned sweet 16 today. Happy birthday, Grace. Sophie Ross Brock loves the movie Frozen. I have 3 daughters, so I know exactly what stage you are in. Olivia Page Pinnell happens to be Representative Steve Massengill's niece up in the north part of our state. Happy birthday, Olivia. To Gatlin Carpenter and Tristan Dorsey. To Heidi Hudson. To Colton Collins. Skylar Gardner. Carly Poland. Happy birthday, Bentley Dow and Amaya. Happy birthday, Johnson Anderson. To Richard McCarty and Brantley Lowry. Happy birthday. Paul Tamborella Jr., his birthday is actually April the 5th. So happy birthday. Cameron and Jack Owens. Jack Owens turned 18 years old on the 4th of April, so a couple of days ago. Happy birthday, Jack. Hadley Grace Bradbury, Andrea Miles, Olivia Page Pinnell, and Madeline Pearson. My buddy Bryson Payne says he loves to duck hunt. Me too. Maybe when this gets over and we get back into duck season, we can both have a great time getting back out there. Sam Ladner and Estelle Pointer, to Hart Hines and Trey Johnston, to Skylee Cook and Catherine Langston. Landry Boren tells me that she is enjoying her quarantine time, hunting, fishing, and being outdoors with her family. Well, Landry, that's a way to have a great attitude. Happy birthday, and I'm proud of you. Taylor Young tells me she's turning 10. Bennett Touchstone and Elijah Lowe all says that their birthday is today. Happy birthday to you. To Garrett Jenkins and Mackenzie Martin. To Caitlin and Shania Dixon. To Mackenzie Sullivan and Carly Rawls. To Gavin Davis. To Say Envy. To Jackson Bryce Ware. And to Christian Hines. Happy birthday from me and my family. Reagan and Riley Carney are twins that are turning 15 today. To Jaylyn Leadhigh To Brody Fitz, to Joycelyn Reese, to Patrick Ken, happy birthday. Terriona Reese tells me that she loves math and science. Happy birthday. Carly Friery and Julie Turner have a birthday today. Julie's mom tells me that Julie is a major fashionista. So hopefully we'll get through this coronavirus and you'll get to get back out there and see if you can't buy you some more outfits to wear. Bryson enjoys playing astronaut. He often talks about aliens, but he thinks these aliens are friendly. Well, Bryson, one of the great things about Mississippi is we have the Stennis Space Center down in Hancock County, and nobody goes to space without going through Hancock County. To Michael Robbins and Kaylee Nipper, to Jamar McCoy, today is Jamar's first birthday. To Camille Phillips, I'm told that she has a lot of stuffed animals and they're all named Cutie. Well, Camille, tell Cutie and Cutie and Cutie I said hello and happy birthday to you. Kennedy Reagan tells me that she loves Disney princesses, and as soon as we get home each day, she puts on one of her mini princess costumes. I hate to keep repeating myself, Kennedy, but I got 3 daughters, and they all did exactly the same thing. So happy birthday. To Tremaine Robinson and Mackenzie Jackson, to Corbin Luke Gatlin, to Michaela Hood and Justin Jenkins, happy birthday. To Randy Adams and Lane Denley, to Will Middleton, Maddie Camp, and Heath, happy birthday to all of you. And finally, I have a lover of the University of Southern Mississippi baseball team, Mr. Caden Hall. Happy birthday to you, and I can't wait till college baseball gets rolling again. And if we all do the things that we need to do over the next several weeks and days and months ahead, we'll get that baseball back playing very, very soon. To all of you in the media, thank you for what you're doing to cover this. This is unparalleled and unprecedented for all of us. We've got to continue to provide accurate information to our people, because as we provide accurate information and show that we are preparing for a surge over the next 10 to 14 days, I believe in my heart that our people will pay attention and that they will do what needs to be done so that we can lessen the devastation that occurs in the great state of Mississippi. Thank you all, and God bless. Thank you, guys. Appreciate you.
Thank you, Governor.